Hi, how can I help you?
I have an appointment with Dr. Stevens.
This is your first time here?
Yeah.
Oh, so since this is your first time, you have to fill like a few papers, like a record, medical record. So I'm gonna bring it to you. You can take a seat, and the doctor is gonna call you when he don't have a patient. Okay?
Okay.
Mr. Wilson?
Yeah.
All right. Will you come with me, please? Thank you very much. Nice to meet you. All right. So, how can I help you today, Mr. Wilson?
Yeah, I'm having some blurry vision, especially at night, and I wanted to get some glasses to see if you could help me with that.
Okay. Is there anything else that's bothering you at all today?
For the most part, it's the blurry vision.
Okay. So I'm just going to read these documents here. Alright. So according to these documents, it says you were diagnosed with type 2 diabetes in 2019. Are you receiving any treatment for that?
No, I went to the doctor a year ago, and they ordered a test to assess my blood levels, and I did the test, but never went back to the doctor because I was afraid of hearing the results, because I never got the treatment.
Is that test in this right here?
Yeah, it's all in this right over here.
Okay. Alright. Okay, according to these tests, it says your blood sugar levels were 10.1 millimoles per liter. Do you know what this means?
No, not really.
Okay. Well, would you like me to explain a little more about it to you?
Yes, please, if you can.
Alright. Well, this means that your blood sugars have been high for about 3 months. So, these results kind of give an average of how your blood sugar has been doing for a certain amount of time. And this number is really high, so that means your diabetes is uncontrolled.
So what would you recommend that we do today?
I think we should do a full eye examination, mostly because your diabetes can affect how you're seeing. So really that's going to help you with that driving at night problem. So if you'd like to just come over here, we'll go do that. Oh, you sit right here for me. Right. Okay, Mr. Wilson. So I found several things while examining your eyes. I know you told me that you don't want to know about diabetes because you're afraid of hearing about its effects because your dad died from it. And I know this is very hard and difficult to understand, but it affects your health a lot. So I am here to help you and make sure you can do and see as best you can.
Yes, I am a little afraid to talk about it, but now you've eased it a little bit better. So what would you recommend that I do?
Yeah, being afraid is totally normal. It is a scary thing. And the fact that you're willing to listen to me, even though you have a lot of fears, is the first step to helping you get these diabetes under control. Okay, and this is another scary thing that I have to discuss with you. And I have found through the tests that you have a disease called diabetic retinopathy.
Oh my God, am I dying?
No, you're not dying, but it would be helpful to see your primary care and physician and discuss with them on how to better control it. Mostly because it can, obviously you're here today because it's affecting your vision, and getting that under control can help with these aberrations.
Well, because of my job, it is difficult for me to go to the doctor's office. So I was thinking it will be a while before I can go to my primary.
Yeah, going to a doctor's appointment does take a significant time of your day, and this effort will have a lot of benefits for you in that long term. I mean, you won't be able to do work if you don't take care of yourself first too. So for today, what would be a good first step for you?
I think I definitely need glasses so I can see better.
Okay, perfect. That's all right. We will definitely get you prescription. I actually have it right here for you. All right. And my receptionist can help you with setting up another follow-up so we can make sure that you're still seeing okay and make sure this diabetic retinopathy doesn't progress. And also that he can help you with setting up an appointment with your primary care doctor.
Okay, thank you.
Yeah.
This situation is an example of an effective interaction between a doctor and a patient. As doctors, it is important to consider that the way we treat our patients does make a difference in their compliance, and therefore in their health. A big part of that interaction is how we lead the conversation with the patients, allowing them to express their thoughts, doubts, and fears. All this while trying to lead an effective and successful conversation that leaves the patient feeling secure and willing to do what is needed to ensure his well-being. Motivating the patients using different techniques such as reframing, reflecting, and using a strengthening confidence talk can make a huge difference in the outcome of a patient's decision making.
So just take this to him.
Yep, that'd be great.
How was your appointment?
It was pretty good.
Yeah.
It wasn't really intense, but the doctor was very helpful.
Okay, you want to order your spectacles now?
Sure, let's go ahead and order them.